Complex RN/NGN practice questions free. Question 1. Set 1. A patient is receiving vancomycin. The nurse notes redness on the face and neck. What should the nurse do? Stop the infusion immediately. Slow the infusion rate. Administer epinephrine. Document as a normal finding. Red man syndrome is often caused by rapid infusion of vancomycin. Slowing the rate usually resolves it. Question 2. Set 2. A child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee chest position, prone, side lying. Knee chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 3. Set 3. Which sign is a hallmark of pyloric stenosis in infants? Green diarrhea, projectile vomiting, steatorrhea, abdominal distension. Projectile vomiting after feeding is the classic sign of pyloric stenosis. Question 4. Set 4. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 5. Set 5. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hemoptysis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 6. Set 6. What is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 7. Set 7. What is the priority when a patient falls? Complete an incident report, notify the physician, assess the patient for injury, move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 8. Set 8. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 9. Set 9. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 10. Set 10. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 11. Set 11. A patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 12. Set 12. A pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 13. Set 13. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity. Question 14. Set 14. Which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 15. Set 15. What is the golden hour in newborn care? the first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 16. Set 16. What is a common side effect of ACE inhibitors? Constipation, dry, non-productive cough, weight gain, hyperactivity. A dry cough is a common side effect of ACE inhibitors due to bradykinin accumulation. Question 17. Set 17. What is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 18. Set 18. What is the priority intervention for a patient experiencing chest pain? Administer morphine, obtain a 12-lead EKG, check blood pressure, call the family. A 12-lead EKG is the priority to determine the cause of chest pain, ischemia versus ME. Question 19. Set 19. A patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 20. Set 20. A mother is Rh negative and her baby is Rh positive. When should she receive RhoGAM? At 28 weeks and within 72 hours of delivery, only at delivery, only if she has a second child, at every prenatal visit. RhoGAM is given to prevent isoimmunization in Rh negative mothers.